at the African Union headquarters in Addis Ababa, Ethiopia, where thousands of delegates are gathered for this year's Heads of State Summit, medical experts are not taking chances. Everyone who goes through the doors is tested for the symptoms of the deadly coronavirus. At the beginning of the year, only 4 countries, South Africa, Cameroon, Ghana and Nigeria, had laboratories with the capacity to diagnose for the coronavirus. Now the Africa CDC says it has upped the numbers of countries which have the capacity to diagnose.
I think our continent is better prepared today than it was 2 weeks ago or even 1 week ago. We are very excited that 15 countries just finished their training on diagnostics in Senegal, in partnership with the Pasteur Institute in Senegal. So from Monday, these countries should be able to conduct an accurate test.
The Africa Center for Disease Control and Prevention was set up in 2017. Its first challenge was responding to the Ebola outbreak that devastated West Africa. Without enough funds to train experts as well as conduct surveillance, the CDC has partnered with foreign donors. China has offered to help in the construction of the headquarters.
The promise we got from China and commitment is $80 million for the construction. And then after that, we'll determine, based on our own priorities, if we need to get experts from China.
The close relations between China and Africa have put the continent at a higher risk of the disease entering the continent, as China now has close to 2 million of its citizens in Africa, with regular flights between the two. With the continent's weak health systems, African experts have warned that all efforts should be concentrated on trying to keep the coronavirus out of the continent. African governments have responded the best way they know how. While the World Health Organization has warned against alienating the countries, some airlines, including Kenya Airways and Rwanda Air, have cancelled their flights to China against the WHO advice. Ethiopian Airlines, Africa's largest carrier, has however continued to fly to the country. For now, all efforts have concentrated on surveillance, with both the WHO and China sending diagnostic kits to the continent. Sarah Kimani, SABC News in Addis Ababa, Ethiopia.